Now we'll talk about infant CPR. We just discussed scene safety, but remember, we need to assess the scene before entering any room. When we assess an infant, we're not going to shake and shout as we did for an adult or a child. We need to try to arouse and stimulate this infant in different ways. We can begin by trying a tap on the bottom of the foot, tickle the bottom of the foot, or even a sternal rub if we want to try to see if there's any response. That's how we're going to assess this infant. When we determine the infant is unresponsive, you yell nice and loud, "Help, I need help." If you have a cell phone readily available, or you have someone in the room with you, you can call for help using them as the assistant or using your cell phone. If neither are available, you're going to move forward with your assessment. To check a pulse on an infant, we need to check a brachial pulse. To do so, we'll locate the inside of the arm with our 2 fingers, our thumb on the outside of the arm, and press lightly to start to feel that pulse. We're still going to watch for chest rise and fall or feel for it, and we're going to assess for both a pulse and breathing for no less than 5, but no more than 10 seconds. Once we've established that they do not have a pulse or they're not breathing, we then start with CPR, beginning with compressions. As a single rescuer, I'm going to compress using 2 fingers. When I do so, please stabilize the head of the infant to support the airway. I may just place my hands on the forehead as I put the 2 fingers from my other hand on the lower half of the breastbone, centered between the nipple line. I'm going to compress at a depth of about 1.5 inches, or 1/3 the depth of the chest. My compression rate remains 100 to 120 compressions per minute, nothing slower and nothing faster. If I'm a single rescuer, my compression to ventilation ratio remains at 30 compressions to 2 breaths. However, much like the child, if I have 2 or more rescuers, we're going to compress using a compression to ventilation ratio of 15 compressions to 2 breaths. Remember, if you're alone and you don't have access to a phone or assistance available to call for help, you will need to do 2 minutes of CPR, or the equivalent of 5 sets of 30 compressions to 2 breaths, before leaving the infant to call for help. When multiple rescuers are available for infant resuscitation, our hand positioning changes. We will use the hands encircling 2 thumb technique in order to deliver compressions. To do so, we wrap our hands around the sides of the infant, and we will touch or slightly overlap our thumbs, placing them directly on the sternum between the nipples, compressing down at a depth of 1.5 to 2 inches at a rate of 100 to 120 compressions per minute. Keep in mind, our compression to ventilation ratio has also changed to 15 compressions to 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15. Good chest rise. Good chest rise. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Good chest rise. Good chest rise.